Can you even spell pneumothorax? Dr. Rebecca Sterling sneered, her manicured finger pointing at the woman in blue scrubs mopping the hospital floor. Pneumothorax, came the immediate reply. And doctor, that patient in room 314 doesn't have pneumonia like you diagnosed. He has a tension pneumothorax, and if you don't decompress his chest cavity in the next 3 minutes, he's gonna die. The entire emergency room fell silent. Before we continue, if you enjoy incredible true stories of underdogs proving everyone wrong, make sure to click that subscribe button. This is the best way for you to support our work. Thank you very much, and let's continue. That janitor was 34-year-old Maria Santos, and what Dr. Sterling didn't know was that she was about to witness one of the most extraordinary moments in medical history. A moment that would expose the dangerous arrogance of the hospital's elite, save a dying man's life, and transform everything anyone thought they knew about the woman who cleaned their floors every night. Maria had been invisible in that hospital for 3 years. Every evening at 6 o'clock, she would clock in, tie her dark hair back in a simple ponytail, and begin her rounds through the sterile corridors of Metropolitan General Hospital. She moved like a ghost through the emergency department, the intensive care unit, the surgical floors. Doctors rushed past her without acknowledgement. Nurses stepped around her mop bucket without a glance. To them, she was just another face in the army of custodial staff that kept the hospital running. But Maria saw everything. She heard everything. And most importantly, she understood everything. What none of them knew was that Maria Santos had graduated summa cum laude from the University of Sao Paulo Medical School 8 years earlier. She had been one of the most promising young physicians in Brazil, specializing in emergency medicine, fluent in Portuguese, Spanish, and English. She had dreamed of saving lives, of making her immigrant parents proud, of building a future that honored the sacrifices they had made to give her opportunities they never had. Then her daughter Emma was born with a rare heart condition that required constant medical attention and surgeries that cost more than most people made in a lifetime. When Maria's husband abandoned them both, unable to handle the pressure and the mounting medical bills, she found herself alone in a foreign country with a sick child and medical credentials that weren't recognized in the United States. The licensing process to practice medicine in America was brutal, expensive, and time-consuming. While she fought through the bureaucratic maze of examinations, translations, and certifications, her daughter needed treatment immediately. The hospital bills were crushing her, and Emma needed her mother more than Maria needed her pride. So she took the only job she could find that allowed her to be near medical care for Emma, that provided health insurance, and that let her work night shifts so she could be with her daughter during the day. She became a janitor at the same hospital where she hoped to one day practice medicine again. For 3 years, Maria cleaned floors while listening to medical discussions. She organized supply closets while doctors debated diagnoses in the hallways. She emptied trash cans while residents presented cases to their attendings. Every night was an informal medical education, and Maria absorbed every word, every detail, every nuance of American medical practice. Dr. Rebecca Sterling represented everything Maria had come to despise about the medical establishment. Sterling was 38, beautiful in the way that only money and privilege could create, with perfectly styled blonde hair and a surgical precision to her makeup that never seemed to smudge even during the longest shifts. She had graduated from Harvard Medical School, completed her residency at Johns Hopkins, and carried herself with the kind of confidence that comes from never having been told she didn't belong somewhere. Sterling had noticed Maria recently, but not in a good way. She had started making comments about the help and their proper place in the hospital hierarchy. She would deliberately drop things near Maria's feet, watch her pick them up, and make jokes to the other doctors about people knowing their role. There was something about Maria that seemed to irritate Sterling, though she couldn't quite put her finger on what it was. Maybe it was the way Maria's eyes lingered on the medical charts when she cleaned the nurses' stations. Maybe it was how she seemed to understand the medical conversations happening around her. Maybe it was simply that Maria carried herself with a quiet dignity that Sterling found threatening, though she would never admit that even to herself. The confrontation had been building for weeks. Sterling had been particularly harsh lately, going out of her way to humiliate Maria in front of other staff members. She would make comments about immigration, about people who couldn't make it in their own countries, about the importance of staying in one's lane. Maria endured it all in silence, knowing that her daughter's health insurance depended on this job, knowing that fighting back would only make things worse. But that night, October 15th, everything changed. It started when 47-year-old construction worker James Mitchell was brought into the emergency room by ambulance. He had been experiencing severe chest pain and difficulty breathing for the past hour. His wife Sandra rode in the ambulance with him, clutching his calloused hand while paramedics administered oxygen and monitored his vital signs. James was a good man who had worked construction for 28 years to support his family. He coached Little League Baseball on weekends, volunteered at his church, and had never missed a day of work in his life. He and Sandra had been married for 22 years and had 2 teenage children who were waiting anxiously at home, afraid to lose the father who was the foundation of their world. Dr. Sterling was the attending physician in the emergency department that night. She performed her initial examination quickly, listening to James's chest with her stethoscope, ordering standard x-rays, and reviewing his symptoms. The chest x-ray showed some clouding in the lower left lung, and based on his fever and productive cough, Sterling made her diagnosis: bacterial pneumonia. It was a reasonable diagnosis given the presenting symptoms. James had many of the classic signs of pneumonia, and the x-ray findings seemed to support that conclusion. Sterling prescribed antibiotics, ordered respiratory treatments, and prepared to admit James to the medical floor for monitoring and continued treatment. But Maria had been cleaning the emergency department during James's entire evaluation. She had observed the patient from a distance, noticed his positioning, his breathing pattern, the way he held his chest. She had listened to his description of the pain, heard the subtle differences in his breathing sounds, and watched the progression of his symptoms over the past 2 hours. Something wasn't right. The pieces didn't fit together the way they should for pneumonia. James's pain was too sharp, too sudden in onset. His breathing was becoming increasingly labored despite the oxygen therapy. His color was starting to change in a way that suggested something more acute than bacterial pneumonia. Maria had seen this before, during her residency in Sao Paulo. She recognized the signs of a tension pneumothorax, a life-threatening condition where air trapped in the chest cavity puts pressure on the heart and lungs, preventing proper circulation and breathing. It was a medical emergency that required immediate intervention, and it was often misdiagnosed, especially when it developed gradually rather than from obvious trauma. As Maria continued cleaning, she watched James's condition worsen. His respiratory rate was increasing, his blood pressure was beginning to drop, and there was a subtle asymmetry in his chest movement that Sterling had missed during her examination. Maria knew that if this was indeed a tension pneumothorax, James had minutes, not hours, before the condition became fatal. She faced an impossible decision. She could stay silent, continue mopping floors, and hope that Dr. Sterling would recognize the deteriorating condition and revise her diagnosis. Or she could speak up, risk her job, risk her daughter's health insurance, and challenge a Harvard-educated physician's medical judgment. The decision was made for her when Sterling noticed Maria's attention to the patient and decided to make another one of her cruel jokes. "Our janitor seems very interested in medical cases tonight," Sterling announced loudly to the nurses and residents gathered around the central station. "Maybe she thinks she knows more about medicine than we do." The comment drew some uncomfortable laughter from the staff, who were used to Sterling's mean-spirited humor but still felt awkward about it. "Why don't we test her medical knowledge?" Sterling continued, walking over to where Maria was cleaning. "Can you even spell pneumothorax?" The question was asked with such condescension, such cruel amusement, that it made several of the nurses look away in embarrassment. That's when Maria made the decision that would change everything. She looked Dr. Sterling directly in the eyes, spelled the word perfectly, and then delivered the medical assessment that would save James Mitchell's life and expose the dangerous consequences of medical arrogance. "Pneumothorax," Maria said clearly, her voice steady despite the trembling in her hands. "And doctor, that patient in room 314 doesn't have pneumonia like you diagnosed." He has a tension pneumothorax, and if you don't decompress his chest cavity in the next 3 minutes, he's gonna die." The emergency room fell completely silent. Dr. Sterling's face flushed red with anger and embarrassment. "How dare you question my diagnosis?" she hissed. "You're a janitor. You clean floors. You don't practice medicine, and you certainly don't challenge physicians with years of training and experience." But Maria didn't back down. She had made her choice, and now she had to see it through. "Look at his jugular veins," she said urgently. "They're distended. Listen to his breath sounds again on the left side. Check his tracheal position. His blood pressure is dropping and his heart rate is climbing. These aren't signs of pneumonia. This is a tension pneumothorax, and he's going to arrest if you don't act now." Dr. Sterling was furious, but some of the other medical staff were beginning to look uncertain. Maria's confidence was unsettling, and her medical terminology was far too sophisticated for a janitor. Dr. Michael Rodriguez, one of the senior residents, stepped forward. "Maybe we should reassess," he suggested carefully. "It wouldn't hurt to take another look." Sterling's pride wouldn't allow her to be corrected by custodial staff, especially not in front of her colleagues. "This is ridiculous," she snapped. "I'm not going to change my treatment plan based on the suggestions of someone who mops floors for a living." But as they argued, James Mitchell's condition was deteriorating rapidly. His breathing had become even more labored. His skin was taking on a grayish pallor, and his wife Sandra was becoming increasingly frightened as she watched her husband struggle. "Please," Sandra pleaded with the medical staff. "Something's wrong. He's getting worse, not better. Can't you do something?" Maria made a decision that would cost her everything but save a man's life. She walked directly to James's bedside, knowing that touching a patient would result in her immediate termination and possibly criminal charges. "Mr. Mitchell," she said softly, "I need you to sit up straighter if you can. I know it's hard to breathe, but this position will help." She helped him adjust his position and then turned to address the medical staff with an authority that stunned everyone in the room. "I am Dr. Maria Santos," she announced, her voice carrying the confidence and knowledge that 3 years of hiding had suppressed. "I graduated from the University of Sao Paulo Medical School with honors. I completed my residency in emergency medicine. I am currently working to obtain my United States medical license, and I am telling you that this man has a tension pneumothorax that will kill him if you don't act immediately." The revelation sent shockwaves through the emergency department. Dr. Sterling's mouth fell open in disbelief, while the other staff members stared at Maria with a mixture of confusion and dawning respect. Dr. Rodriguez stepped forward again. "If you're really a physician, then you know we need to confirm this diagnosis before we can perform a procedure like chest decompression." Maria nodded. The classic signs are all there: chest pain, dyspnea, tachycardia, hypotension, distended neck veins, and decreased breath sounds on the affected side. But if you need confirmation, do a stat chest x-ray or an ultrasound. Just do it quickly because we're running out of time. Dr. Sterling was caught between her professional pride and the growing realization that Maria might be right. The patient was clearly deteriorating, and several of the signs Maria had pointed out were indeed present. If she was wrong about the pneumonia diagnosis, and if Maria was right about the tension pneumothorax, Dr. Sterling's career could be seriously damaged. "Fine," Sterling said through gritted teeth. "Get me a portable chest x-ray stat, and call radiology for an immediate read." The next few minutes felt like hours as they waited for the x-ray results. James's breathing became more labored, his blood pressure continued to drop, and his heart rate climbed dangerously high. Sandra held his hand and whispered prayers while tears streamed down her face. Maria stood quietly to the side, knowing that she had done everything she could. Her job was almost certainly over, but she couldn't regret speaking up. She thought about her daughter Emma, about the health insurance they would lose, about the long road ahead to complete her medical licensing process. But she also thought about James Mitchell, about his wife and children, about the oath she had taken as a physician to first do no harm. When the radiology results came back, they confirmed what Maria had known all along. The X-ray clearly showed a large pneumothorax with signs of tension and mediastinal shift. Dr. Rodriguez immediately began preparing for emergency chest decompression while Dr. Sterling stood frozen, realizing the magnitude of her mistake. "We need a chest tube now," Rodriguez called out as he prepared the insertion site. "And get me a thoracotomy tray in case we need to go surgical." The procedure was performed quickly and expertly. As soon as the chest tube was inserted and the trapped air was released, James's breathing improved dramatically. His color began to return to normal, his blood pressure stabilized, and his heart rate started to come down. Within minutes, he was conscious and alert, able to speak to his wife and thank the medical staff who had saved his life. But everyone in that emergency room knew who had really saved James Mitchell. It wasn't Dr. Sterling with her Harvard pedigree and her arrogant assumptions. It wasn't the advanced medical equipment or the hospital's prestigious reputation. It was a woman who cleaned floors at night and kept her medical knowledge hidden because the system had failed to recognize her credentials and her worth. As James was stabilized and prepared for transport to the intensive care unit, Sandra Mitchell approached Maria with tears in her eyes. "You saved my husband's life," she whispered, taking Maria's hands in hers. "I don't know who you are or how you knew what was wrong, but you saved him. How can I ever thank you?" Maria smiled through her own tears. "You don't need to thank me," she said softly. "I just did what any doctor would do. I just happened to be in the right place at the right time." Dr. Sterling had disappeared from the emergency department, unable to face the consequences of her mistake and her treatment of Maria. But Dr. Rodriguez remained, and he was looking at Maria with a new understanding and respect. "Dr. Santos," he said formally, "I think we need to talk. What you did here tonight, what you knew, what you saw that we missed, that was exceptional medicine. I want to understand your situation and see if there's anything we can do to help you get back to practicing medicine where you belong." The story of what happened that night spread quickly through Metropolitan General Hospital. By the next morning, everyone from the custodial staff to the chief of surgery had heard about the janitor who was really a doctor, who had saved a patient's life by challenging an attending physician's diagnosis, who had risked everything to do what was right. Hospital Administrator David Chun called Maria into his office the following day. She expected to be fired, to lose her health insurance, to face the consequences of overstepping her bounds as a custodial employee. Instead, she found herself in a room with Chun, Dr. Rodriguez, and Dr. Patricia Washington, the chief of emergency medicine. "Dr. Santos," Dr. Washington began, "we've reviewed what happened last night, and we've also done some research into your medical background and credentials. We understand that you've been working toward your United States medical license, and we want to help you complete that process." Maria couldn't believe what she was hearing. "I don't understand," she said quietly. "I thought I would be fired. I touched a patient without authorization. I challenged Dr. Sterling's diagnosis. I overstepped every boundary that exists between custodial staff and medical personnel." David Chun leaned forward in his chair. "Dr. Santos, you saved a man's life. You demonstrated medical knowledge and diagnostic skills that prevented what could have been a tragic outcome. Yes, you broke protocol, but you did it for the right reasons, and the results speak for themselves." Dr. Washington continued, "We're prepared to offer you a position as a medical assistant in our emergency department while you complete your licensing requirements. It's not the same as practicing medicine, but it would allow you to use your medical knowledge, work directly with patients, and earn a salary that reflects your education and skills. We'll also provide support for your licensing examinations and help you navigate the credentialing process." The offer was more than Maria had ever dared to hope for. She would be able to work in medicine again, even in a limited capacity. She would earn enough to better support Emma's medical needs. And she would be taking a crucial step toward practicing medicine again in America. But there was something else, something even more important than the job offer. For the first time in 3 years, Maria felt seen. She felt valued. She felt like the physician she had always been, even when the world had reduced her to someone who cleaned floors and emptied trash cans. "There's one more thing, Dr. Rodriguez added. "We've been in contact with the state medical board about your case. Your intervention last night, the way you handled the medical emergency, it's going to be part of your clinical evaluation for licensing. What you did demonstrated exactly the kind of medical judgment and patient advocacy that we want to see in physicians. 6 months later, Dr. Maria Santos passed her final medical licensing examination and was officially authorized to practice medicine in the United States. Metropolitan General Hospital offered her a position as an emergency medicine physician, and she accepted, knowing that she would be working alongside some of the same people who had once walked past her without acknowledgement. Her daughter Emma's health had improved significantly with better access to specialized care, and Maria was finally able to provide the kind of life for her daughter that she had always wanted. The little girl who had once spent her days in hospital waiting rooms while her mother cleaned floors was now able to see her mother in scrubs again, saving lives and making a difference. Dr. Rebecca Sterling had quietly left Metropolitan General Hospital shortly after the incident. The medical board had investigated her handling of James Mitchell's case, and while she wasn't formally disciplined, the scrutiny and embarrassment had made her position untenable. She transferred to a smaller hospital in another state, where hopefully she learned to treat all people with the respect and dignity they deserve. James Mitchell made a full recovery and returned to work within a few weeks. He and Sandra became close friends with Maria and Emma, and James never forgot that his life had been saved by a woman whose intelligence and medical expertise had been hidden behind a janitor's uniform. He often told the story to his friends and family, emphasizing that you never know who the people around you really are or what extraordinary capabilities they might possess. The incident sparked broader conversations at Metropolitan General Hospital about respect, dignity, and the value of every person who worked in the institution. The custodial staff, the cafeteria workers, the maintenance personnel, all of the people who kept the hospital running but were often treated as invisible, began to be seen and appreciated in new ways. Dr. Rodriguez, who had been the first to support Maria's assessment that night, was promoted to Assistant Chief of Emergency Medicine. He implemented new protocols for encouraging medical input from all staff members, recognizing that valuable observations and insights could come from anyone who spent time observing patients and medical procedures. But perhaps the most important change was in Maria herself. For 3 years, she had hidden her light under a bushel, accepting a diminished role because circumstances had forced her into it. She had allowed herself to be invisible, to be dismissed, to be treated as less than she was. That night in the emergency room, when she chose to speak up despite the personal cost, she reclaimed not just her medical identity, but her sense of self-worth and purpose. Today, Dr. Maria Santos is one of the most respected emergency physicians at Metropolitan General Hospital. She has become an advocate for immigrant physicians, working to streamline the licensing process and create support systems for doctors who are rebuilding their careers in America. She speaks at medical conferences about the importance of recognizing talent and expertise wherever it exists, and about the dangerous consequences of medical arrogance and hierarchy. Her story has become legendary in medical circles, not just because of the dramatic save that night, but because of what it represents about potential hidden in plain sight, about the importance of listening to all voices, and about the courage it takes to speak truth to power when lives are at stake. Emma Santos, now 11 years old and healthy, often visits her mother at the hospital. She loves to see Dr. Santos in her white coat, stethoscope around her neck, moving through the emergency department with confidence and purpose. Emma understands that her mother once cleaned these same floors, and she's proud of the journey they've taken together. The night shift janitors at Metropolitan General Hospital still clean the floors, still empty the trash cans, still move through the corridors with quiet efficiency. But now, the medical staff acknowledges them, speaks to them, recognizes that every person in that hospital has value and dignity. Some of the doctors have learned that their night shift cleaner is working on a nursing degree, that another is a former teacher, that another speaks 4 languages and helps with translation for patients. You never know who the people around you really are. You never know what knowledge they carry, what experiences have shaped them, what contributions they could make if given the opportunity. Maria Santos was a janitor, but she was also a physician. She was invisible to most people, but she saw everything that mattered. The medical term that Dr. Sterling asked her to spell that night was meant to humiliate her, to put her in her place, to demonstrate the gulf between those who belonged in medicine and those who didn't. Instead, it became the key that unlocked years of hidden expertise and saved a man's life. That night, a construction worker named James Mitchell went home to his family instead of leaving them in a hospital morgue. A little girl named Emma got to keep her mother's health insurance and see her dreams of medical practice restored. And a woman who had been invisible for 3 years finally stepped back into the light where she belonged. Sometimes the most extraordinary people are hiding in the most ordinary places. Sometimes the most important voices are the ones that have been silenced by circumstance or prejudice or systemic barriers. And sometimes it takes a moment of crisis to reveal the heroes who have been among us all along, waiting for their chance to make a difference. The next time you see someone in a service job, someone whose work makes your life possible, but who seems invisible to the world around them, remember Maria Santos. Remember that behind every uniform, every name tag, every person who society overlooks or undervalues, there might be someone extraordinary waiting for the chance to shine. Maria Santos spelled more than a medical term that night. She spelled out the truth about human dignity, about hidden potential, about the courage it takes to speak up when lives are at stake. She spelled out the difference between having credentials and having wisdom, between holding a position and earning respect, between being seen and being truly valued. And in the end, that spelling test saved more than one life. It saved James Mitchell from death, it saved Maria Santos from invisibility, and it saved an entire hospital from the dangerous blindness that comes from judging people by their uniforms instead of their hearts.